Hey, hello, and welcome to the Feel Strong Fitness Podcast. My name is Justin McClintock, and this week, Dr. Lance Einerson is our guest. Today's episode is a conversation that could change how you think about back pain. What if the key to a pain-free life lies not just in treatment, but in understanding and empowerment? We discuss Lance's inspiring background as a teacher and mentor, his expertise in helping individuals overcome back pain by addressing its root causes. Lance emphasizes the importance of lifestyle changes and mindset in managing pain, advocating for a holistic approach that balances both emotional and physical health. We dig into the limitations of traditional medical methods and share how setting meaningful goals can lead to real progress. Lance also reveals his exciting plans for the Mentorship Program, the Durable Spine Society, aimed at equipping coaches and clinicians with the tools they need to make a real difference. Whether you're struggling with back pain or simply looking to enhance your fitness wellness journey, this episode is packed with valuable insights. Dr. Lance Einerson is on the Feel Strong podcast. Dr. Lance Einerson, welcome to the Feel Strong podcast.
Thanks for inviting me. I'm excited. I like having these conversations. It's always a good time.
I'm excited to have you on. I mean, I've known you as a bunch of different things, and I'm interested before we launch into some of the topics we were talking about, kind of how you think about yourself. I feel like I've known you as a coach, as a teacher, as a mentor, as a physical therapist, as someone who designs courses for other teachers to teach. How do you think of yourself these days?
I think as a teacher is probably that's the main, if I wanted to put a title on it, it would be a teacher, maybe a mentor. But I really enjoy taking concepts that are difficult for people to understand and breaking them down in ways that are no longer difficult to understand. So it's like, hey, here's this big, ugly, scary, hairy problem that a lot of people are dealing with. Let's make that approachable for the people who have the means to be able to solve that. So whether that's a physical therapist in a clinical setting, or that's a coach who is actually spending a lot of time with their clients who have, whatever various issue, and they're better positioned to solve that than, say, like a medical professional. So it's, taking that big, hairy, scary thing and condensing it down into something that's digestible, and also just making content about those things that is entertaining. So like that whole spectrum, because it's like I'm rambling now, but it's kind of like a teacher, but then also of like telling a story as well, like bring those two things together. That's how I see myself. And like, that's what's most rewarding for me.
That totally makes sense. And I didn't even think of that creating content and kind of communicator part that you're also very adept at, of saying, I've watched you talk to coaches and people who want to do things like this. How do I tell someone what I do? These are the 3 things that I do, but I don't understand how to get someone's eyes on it or get them to care. And you're also very adept at sort of finding your way into ways that these sometimes challenging or really big concepts can resonate with the people you need them to resonate with, if that makes sense.
Thank you. I appreciate that. I think that I'm just kind of thinking about that now of okay, why that's true, but why? And I think a lot of that stems from me being I used to be really shy, I guess, more of introverted, it was a big energy ask for me to connect with people. And so expertise was the way that I did that. That was my shoehorn into connection with a lot of people of oh, hey, here's this expertise. So if I know stuff and I can communicate that in an interesting way, that's an easy way for me personally to be able to branch out, to not be, I guess, isolated, which is something I have a tendency towards. So, yeah, I don't know. You're just psychoanalyzing me into a better version of myself, Justin. Thank you. You're
absolutely welcome. And that, what you just said resonates really hard for me as someone who used to be half of the way I would make friends was by being the best study partner you could have, because I had incredible notes. I basically had photographic memory of what the lecturer said. And if we would hang out, I would just tell you what they said and the way it was probably going to work on the test. And I was right. And that's how I would kind of make friends. If those were friends, I'm not sure.
Yeah, there you go. Well, that's how you can make some connections, right?
Yeah. Yeah, it's something. And it certainly helped. And it did help me get out of my shell in a very significant way and lead to other performing stuff and things like that. Speaking of big, hairy concepts, you are sort of specializing these days in back pain and helping people solve their back pain, as well as telling other coaches and people how they can approach this stuff. I don't think most people know what a big problem back pain is right now.
Yeah. So something like 80% of people throughout their lifetimes will deal with some sort of back pain, which is, like that's not super surprising, right? Everybody knows someone with back pain. But on top of that, back pain is the number one cause of disability globally. It's the thing that causes the most loss of independent life, I guess is the way you could say it, or life without disability of anything else in the world. Like back pain. Like you'd think it'd be something of like cancer or like heart disease, since that's the number one killer in, the United States and Europe, but it's not. It's back pain. And back pain can be anything from, like, hey, this is annoying, I would prefer this not to be here, to like, my life has been completely derailed and this is horrible. I have nothing left. I'm at the end of my rope. So there's a big spectrum there. And frankly, a lot of the solutions that are available are just, they're garbage. It's either, rest, avoidance, medication, surgery, or it's just wait and see, or it's just deal with it. Like you got to live with it. And those aren't great solutions, especially for how prevalent it is. So the big thing for me was that I saw that's a really big problem. And then also that's the most interesting problem for me to solve in terms of my skill set as a physical therapist or as a coach, depending on how I'm functioning. It's the most interesting thing for me to solve because there's so much at stake for so many people. There's so poor solutions, like we talked about. And frankly, a lot of the other stuff, it's just boring for me. Of like, it's like, okay, your knee hurts. Great. Well, we're going to manage volume. We're going to do some HSR because, connective tissue is weak or what, like whatever. It's the same thing over and over and over and over and over again. And I hate that. But back pain has some character to it. So it's a lot more intriguing for me to dive into that thing.
That's really interesting. I think it points to something that a lot of people feel around back pain, is that it is often perceived as basically mysterious, especially if it's outside of, well, I was deadlifting, my back started hurting, so deadlifts made my back hurt. There's people who just wake up and are like, I walked a little more than I did usually yesterday, or I have new shoes, or they're trying to pinpoint something. But essentially back pain comes out of nowhere. They don't know why it happened. They don't know what to do about it. And they certainly don't know how to solve for it.
Yeah. And that's really one of the most interesting conversations that I have on a regular basis with people is it's like, hey, here's this thing. It seems like it came out of nowhere. Like, what's the deal? And there's a couple things there. The first is that lifestyle consequences don't appear immediately. They accumulate over time, right? So it could be like, maybe you were super active in your 20s. Like you were really athletic, you were doing the thing, you didn't have any pain, like you had little things, little injuries that happened here and there that were just like normal because you're an active individual. But then you hit your 30s and things start to feel a little worse, maybe, or your 40s, whatever. And it feels like it comes out of nowhere. But in reality, it's like, well, you stopped doing the things that you were doing before that were protective. You started sitting way more. And some sitting is okay. Like if you're over 3 hours a day, your odds for low back pain and risk for disability increases. But below that, it's like you like sitting. There's nothing wrong with sitting. Like sitting is not a bad thing. But you're sitting more, which also means you have less time that you're doing those other active things. You have a bunch more stress. Maybe you have kids or you have a more stressful job. You have more responsibilities that way. So that's sucking away your bandwidth and you have to manage that stress. How's your nutrition going? And like, how's your sleep? All of these things, those pile up and you don't experience the consequences from those immediately, but you might in 2 years, 5 years, 10 years. And it feels like this mysterious thing, like you just got hit by a freight train out of nowhere. Like, well, it's tracks. Like, what just happened? Like, this is terrible. But the clues are there, right? Like, actually, I made a post a while ago saying that figuring out what's going on with your back pain is like playing Clue. It's like the first roll, you're not going to know who did it, where they did it, and what weapon they used. It's going to take a little bit. And so having those conversations like, what's in your lifestyle? What are you doing? What changed? What was the mechanism of injury? All this stuff. It takes a few rolls. And a lot of times, or at least I believe, the reason people get derailed and have such poor outcomes with back pain is that they're only willing to, take, with this analogy, roll the dice, take a turn, whatever you want to call it. They're only willing to do that a couple times. And it's just not that clear that quickly. You got to unpack the lifestyle. You got to get them back to moving. You got to, figure out exactly where they are to establish a clear baseline and then progress them towards they want to be, reverse engineer that process of like, hey, this is where you are. This is where you want to go. You're not going to do that in 2 weeks. You're probably not going to do that in 3 months if you haven't exercised since the Cold War was over, right? That sort of.
So many ways to go with that. The first thing that comes to my mind is, how do you even get there? Like, someone shows up, like, yeah, I was deadlifting in a CrossFit and I hurt my back and it's been hurting for 8 weeks now. How do you take someone who walks in? Because I suspect a lot of the time that person is like, hey, can you crack my back or give me some manual therapy, give me the 4 exercises I should do twice a week, and I'll be good in 4 weeks. How do you go from that to, well, let's look at the last 10 years of your life, or 15 or 20?
Yeah. Well, it depends, right? So for somebody like that, let's say that person is, 35 years old. And you have a conversation of actually things are going pretty well, but maybe they weren't sleeping great for the couple weeks before that. And, their recovery was not great because they were extra stressed, whatever. The solution for that isn't going to be super complicated. It's not going to be the same for the person who had a decade of doing nothing beforehand. But regardless, what it is, at least the way that I will approach it is, it starts with a conversation that is very question heavy on my side, so that it's a couple things. It's me gathering data, and it's also showing them how to see in their blind spots. So I'm not telling them what to see, the whole idea of I'm not going to tell you where to or what to see, just where to look. That idea, but directing that toward their blind spots. So for that person, right, it's not going to be super complicated. It's like, hey, you know what? This was the instant that the injury happened during the deadlift. I'm not going to argue about that. Of course that's what happened. But why? Why do you think that happened? What led up to that? Tell me about how you were sleeping the couple weeks before. Tell me about your stress levels. Tell me about the strategies that you have to deal with those things. It's those kinds of questions and that kind of conversation that you can unwind what was really happening. And so it's like, yeah, we're going to give you these exercises. We can do a little bit of the manual therapy stuff and that kind of thing if that's what you want, because it'll feel nice, right? It's not going to heal anything. It's not going to make it better, but it'll feel nice. That's valid. That's valuable. But the most valuable thing that person can take from that conversation is the understanding that they can avoid a lot of the future injuries or falling into that cycle of repetitive re-injury by examining and being more conscious of the way that they live on the front end, so that it sets them up for success rather than making them more and more vulnerable to more issues in the future.
Doing that kind of education, back to you being a teacher, also gives them the tools to deal with things like this in the future. So wouldn't it be cool if they don't have to come back to someone like yourself all the time and they can say, wait a minute, my sleep is going to hell and my stress is through the roof, and maybe I should manage my exercise load or do things so my sleep can, improve, and do some sleep hygiene or start noticing those other things rather than just waiting for the moment of catastrophe to be the thing that makes it obvious they need to make a change.
Yeah, absolutely. That's the greatest compliment to me. The greatest compliment to me as a professional would be that I never see you again. Right? It's just that, here's the thing, the problem solved. You have the tools to not ever have that problem or problems of that genre, I guess you could say, ever again. And when your friends and family have that thing going on, you're like, hey, you should go see that guy. Go talk to him. Here's his Instagram profile. There's a bunch of stuff on there. It'll be helpful for you. Whatever, right? And that's what we want. want that independence so that it's not, oh, I have to be dependent on this person forever. I need lifetime care. Somebody to crack my back twice a week for the next 9 months.
Forever?
Yeah.
How can the plan be see you twice a week for the next year? That's not a plan. You just told me your thing, it doesn't work. Like, what are you talking about?
Yeah. Yeah, absolutely. Absolutely.
I've been telling people, or kind of throwing around lately, the term, I want to be the last coach you ever need. I'm happy to be a coach you want, potentially. If we're both inspired to work together, then super cool. But I want everyone to get to the point that they need neither me nor any other coach because they're so educated and so autonomous that they can be as independent as they want to be. If they want someone else to write their stuff for that, too, I get that. I have a coach. Coaches need coaches. But the distance between being dependent and really needing someone and choosing that service, if you want, I think is really significant and not everyone understands.
Yeah, absolutely. Like, it feels so much better. Just, I don't know, maybe this is just partially my personality of being pathologically independent, but like, it just feels so much better to know that I can do pretty much anything that I need and want to do. Like, that feels great. That doesn't mean that I'm never going to have a coach, right? Like, I go to jiu-jitsu 3 days a week, coach, right? Who knows so much more than me. Feels so good as well, not to be the person who needs to have all the answers in the room, right? So like, there's that flip side of that. But to know that if anything goes wrong musculoskeletally for me, or is like lifestyle based issues, I don't need help. Theoretically, neither should my clients.
Yeah, I think that's a really powerful mindset and a strong, frankly, business philosophy that not a lot of people share. On that note, there's a lot of people out there who have a quote unquote bad back or back issues, and there's sort of a few things they don't do anymore because they've gotten a little older and they can't do it. I strongly believe that a lot of those people are wrong.
That they can do it?
I think that a lot of these problems are actually solvable. Their back probably isn't bad. It's fairly unlikely that they can't go for the hike or play pickup ball with their friends or any of these things that they've stopped doing because they're, 43 and they've decided that's too advanced. How do you approach people in that mindset?
A lot of it for me is a discussion of whether or not they want it. Like, it comes back to that, right? Like, what is your desire? Like, do you want to be able to do those things? Is it important for you to be able to do those things? Actually, I was writing a case study yesterday about a woman who wants to run a half marathon with her teenage son. And that was the goal. But having a goal that is, I don't want to say that superficial, but it's just, it has that small of a footprint, a better way to put it, has a small footprint of, like, I want to be able to do this thing. Like, yeah, well, back hurts. Can't run that long. Can't do it. Want to do it. Like, okay, like, why do you want to do it? And you unpack those things, and it's like, first, it's like, well, we just talked about it. I thought it'd be a fun thing to do together. Well, okay, like, let's talk a little bit more about that. Like, why is that important to you? Like, well, I want to build memories with my son. Okay, cool. You want to build memories with your son. Is that not something that you can do in other ways? Yeah, I can do it in other ways, but like, running was the thing that we connected on when he was struggling when he was younger. And like, that was just like a strong relationship thing for us. Like, okay, so this is something that's really important for you. But yeah, and it's like, I used to be able to run. Like, I felt like that was a big part of me. I can't do that very much anymore. Like, okay, so it feels like you're losing part of yourself because you can't run like you used to. And you're not able to build the memories that you want to build with your son. Is it accurate? It's like, yeah, that's exactly the thing. Okay, that has way more meat on the bone than I want to run a half marathon. Like, I want to be the version of myself that I want to be. I want to do those things. And it's not just because I want to do them on a whim. I want to do them because it means something to me, to my family, to, whatever. Right? So having that thing that has more meat to it, like, that makes all the difference.
It's also a much stronger thing to come back to when things get hard, right? Because everything, like, I've never had plan A work in a straight line. Sometimes it goes faster, sometimes it goes slower. Usually there's some bumps in the road. And when things get hard, if you say, well, if you don't do this, then you might not be able to run a half marathon. That's a lot easier to shrug off than you said you want to be the kind of person your son can look up to. That's, okay, I'll do this stupid calf mobilization. But that kind of thing, I mean, I'm making light of it, but having something that big, it also, I think, not instinctively, gives you way more opportunity for success. Because then you're like, well, wait a minute, you want to run a half marathon. Does that mean if you ran 10 miles with your son, it would be a failure? And if that's true, then we might have a problem and you and I probably aren't working together. You want to be this kind of person. What would that kind of person be able to do? And now you can make a list that goes on and on of all the kind of things that sort of person would be able to do. A half marathon may well be on that list, and it's a fine goal. But it gives you so many more ways to succeed than, I wanted to do this tiny thing that maybe I care about, maybe I don't. Oh, it didn't happen. Oh well, back to the beginning. And people get caught in this cycle of not really going anywhere because they don't understand why they want to move in the first place.
Yeah, absolutely. It gives it weight, and that's what a lot of people need, especially with back pain, because it's such a convoluted path, typically from A to B. It's not like straight line, like you said. There's a lot going on, and there are almost always significant setbacks. They're more plentiful, and they are worse than most people assume. And I think it's also valuable on top of that more like emotional stuff that we just talked about around that goal, is also establishing the other kind of like ancillary things that might be problems that they might be experiencing as well. So for example, if we have somebody who can't run for like the half marathon, right? Like that's the goal. But they also have problems like, oh, it hurts when I bend over to pick up a bag of dog food. Or if I have to, if I'm standing around for however long, it bothers me. Or sitting on the bleachers at my other kid's baseball game, whatever sport, right? Like there are these other small things that when you have a list of those, whether you're the coach and you're working with that person or you are that person, those little things will get checked off along the way before you're able to run the half marathon. So it's like, hey, like, is this working? Am I doing the thing? Am I going to get what I want to get out of this? Like, well, let's look back. What were you unable to do? Well, I couldn't sit for the full game because I had to get up and walk around because it hurt too much. I would have to ask, somebody else in the family to come grab the dog food when I went shopping out of the trunk. I don't have to do that anymore. Right? So there are these little things that they keep you from feeling like you're going to walk up to the cliff and just call it quits on this journey. They're objective changes in your experience. So you have that big emotional thing that's pulling you forward, but you also have the objective things that, like, it makes me think of like an extendable ladder, how like when you push it out, it goes like the little click, 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 like it ratchets. So it keeps you from sliding backwards. That's kind of how I think about it. The emotional stuff is pulling you forward, and then those little objective things that you're checking off along the way, those keep you from sliding back.
100%. I just had this conversation last night with someone who's starting as a client in a couple of days, actually, and spent a long time finding things we could quantify. Because the big goal was, I want to feel like this. Great. That's very compelling. What is someone who feels like that able to do? What do they look like? What do they feel like? What do they do? What do they eat? How much time do they have? All of that stuff. Great. These are the benchmarks we would expect to hit on the way there. And we're going to look, in 8 weeks, we're going to have a conversation. How are we feeling about these things? How many of them have we checked off? Are we closer to some of them? If we're not, we also need to keep Justin honest. If we're not making progress here, something's wrong. We definitely need to adjust, especially when you have these like goals that often take, months and months to actually achieve. Earlier, we were talking about sort of standard care for back pain, at least in kind of America, the Western world. I think it was rest avoidance, medication, surgery. Did I get it?
Yeah, a lot of the time. Sure.
That's kind of like the standard line, like let it rest. All right. If it hurts, don't do it. All right. Here's some pain meds. It's still not working. All right. We're going to do some imaging, which is for sure going to show something, and you probably need surgery. That sounds like a path to success for a lot of people. Like, oh, my back has hurt. I have this, bulging disc. They're going to do surgery and fix my back. Why isn't that necessarily the answer for somebody?
Well, first of all, sometimes it is. Depends on the condition. Oftentimes it's not, right? So if you have some sort of like specific trauma, right? Like, oh, I was in a car wreck, or I fell off a ladder, or whatever the thing, right? If you have some sort of specific trauma like that, to where there's been a structural change in your body, that might be the best way forward. Not always. It might be the best way forward. And so when I say that sort of like standard of care is a bad thing, it's not a bad thing for everyone. Like the medical system is set up to deal with trauma. Like that's what it was like founded on, right? Like there was like an explosion at the railroad, or a tractor tipped over on somebody. The Western medical system deals with those kinds of things really, really well. What it doesn't deal very well with are things that are more lifestyle based, right? It's just like heart disease, right? Number one killer in the United States and Europe. Kill way more people than COVID, and it just happens every year, and nobody seems to talk about it very much, just because we're used to it. That's the thing. It's like, oh, well, that's it, right? Type 2 diabetes. Lots of these lifestyle sort of things, often back pain, they don't do very well in that system. And the reason being is because the solution, if it was caused by lifestyle, or at least lifestyle significantly contributed to the thing, you're not going to fix it by not addressing the lifestyle. And rest, avoidance, medication, surgery, those will be temporary solutions to a lifestyle problem. And you end up kind of papering over the issue. And for some people, you might get lucky, and it's okay. You're good. More power to you. Great. For most people, though, when it's a lifestyle issue, you're going to have some relief for a while, but it's a matter of time before you end up in the same spot again. So there's that. Now, a caveat to this would be that sometimes those lifestyle things have progressed so far that maybe you do need some sort of surgery thing. Like it's just so far gone that maybe it's not even that you couldn't be successful with a more conservative approach with, I said lifestyle changes, like exercise, all that stuff, but that the mountain is so big to climb and that it's unreasonable for that individual to do it. So maybe surgery is a thing, but this is the big thing. On the other side of that surgery, you still have to do the work. You still have to make the lifestyle changes. You still have to live in a way that supports pain-free living and living at the intensity that you want to live at. So it's not a check the box, get the surgery, everything's great. There's more to it. That answer your question?
Absolutely. That was very well said. And surgery may well, sort of like, surgery is, a very intense form of manual therapy. I know that's not really true, but that's sort of how I think of like I went and got some dry needling with the stim electricity about a week and a half ago. I'd had this like awful adductor groin injury that I've been dealing with for 20 weeks. And I was finally like, all right, it was getting better and better. And now I've plateaued for months. And PT looked over and did a bunch of assessments and did strength test and did 50 minutes of needling. And now it doesn't hurt. And I have the plan to do all of the strength work and stuff that I can do to make it better and no longer, not again create the conditions for injury and pain. But I didn't have the room to do that before. So creating the space for all that work to happen, great, I'm totally on board. It's really challenging, I found, when people think surgery is the solution. Like, oh, I'll get surgery and I won't hurt anymore. It's like, did your surgeon tell you you wouldn't hurt anymore? Like, they might change the shape of your bone, but did they actually say anything about you not being in pain anymore? Because these may or may not be connected.
Yeah, absolutely. Like, that's a big thing with MRIs, right? Like, unless you had an MRI from immediately before the thing, it's really difficult to say with any certainty that this thing that we see is causing the experience that you have. Like, it's tough.
Yeah. Imaging is, well, you know better than I. What are the, if any, are there downsides to people getting imaging every time that they're hurt?
So I made a post recently that was from a study that they did at the VA, and people who had non-specific low back pain, so meaning that there wasn't like a specific mechanism of injury, right? Like, oh, I didn't get hit by a car. I didn't pick up something heavy. It's like, it just kind of came out of nowhere and my back hurts. What do I do, right? For those people, if they got an early MRI, I want to say it was within the first 6 weeks of having pain. So if they got an early MRI, they were 13 times more likely to have unnecessary surgery than those who didn't. And somebody made a comment on there, and they're like, it's almost like people use the diagnostic tool to find out what's wrong, and then they fix the thing. Like, no, actually, that's not how it works, because those people who had the surgery actually had worse pain outcomes in 5 years than the people who didn't have surgery. And so, like you said before, there's always going to be something on imaging. It's like, if you're over like 18 years old, they're going to find something on the MRI. Part of that is just so that the radiologist can cover for themselves of like, hey, I have to say everything that's on here, or else I'm going to be held responsible for whatever happens after this. And then the way that's presented to the patient by their doctor is like, hey, you have all of these things going on. They might all be causing the pain. The thing is, none of them might be causing pain as well. Because I want to say, I haven't looked at the study for a while, but I want to say that it's something around like 80% of people walking around have abnormal disc findings in, like, if they were to have an MRI. So 80% of asymptomatic people have disc abnormalities if they were to get an MRI. And it's like, well, if this person has the same exact thing as me, but they don't have pain, what does that mean? Right? Like, it means that there's hope that you could do this without surgery. That's cool, right? So the whole imaging thing, it's kind of a can of worms. It's an extremely powerful tool, and it's a godsend when it's used properly. It can also be used improperly and is just basically a highly effective marketing funnel. So that's one of those things where it matters for you to be able to advocate for yourself as well.
Yeah, 100%. And back to educating people. I say the same stuff about most Western medicine, honestly. Like, this is, a hair's breadth short of magic. It's incredible that we can do this. Is it actually the right thing for you right now? Let's talk about it. Here's some questions you can ask. I am totally the guy, as someone who's married to a physician who occasionally rolls their eyes when this happens. I am the guy who sends someone with the piece of paper with the questions on it. My wife is like, someone brought a list in today. I was like, do I know them? I might have sent them. She's like, no, they were really good questions. I just when I see it, I never know what's coming, and it's a whole thing. You're like, but on the other hand, when they ask good questions and advocate for themselves, it actually helps great medical professionals do their job better.
Yeah. Yeah. Honestly, that's like a green flag, I guess you could say. Like, if your physician is willing to go over your questions with you and to have a conversation instead of just brush them aside, probably found a good one.
And if they're not, exactly the opposite. If someone won't answer your questions, that's probably not the person to trust with your care.
Yeah, absolutely.
There's a cool thing you're working on. And I think this is okay to talk about. And if it's not, we'll cut it out. But we had talked before about you potentially creating kind of a mentorship program for other people to build these skills, be able to do some of this work that you're doing. I don't want to put words in your mouth, but do you mind talking about that?
No, absolutely. So what I'm working on is, it's a mentorship community. It's just educational resources. I'm not really sure what to call it or what to label it, but essentially what it is it's a place for coaches and clinicians to come together to be able to learn more about how to help people with back pain, right? It's that big, hairy problem that there aren't a lot of great solutions available for it. And so that does two things. It means there are a lot of people who aren't getting the help that they need. It also means that there is a lot of opportunity for coaches and clinicians who have or want to have the skills necessary to help those people to be able to run a great business, right? So it's both. It's not like, hey, here's this thing and there are these desperate people you can take advantage of. It's, hey, here are these people whose lives are being derailed, and you can be the one that helps them change that, right? And so essentially what it'll be is there will be a curriculum that when you join the mentorship, there's a curriculum and you get a chunk of it every month of like, hey, here's the stuff. Here's the thing that you're going to learn this month. You can take it, apply it, do with it what you will. And you'll also have access to me. So like there'll be like a weekly, I guess you call it a roundtable, to where we'll discuss something of like, maybe it'll be a research thing of like, hey, this came out this week or this month. Here's some cool points that I pulled out of it. You know, you can use this, take it, run with it, do what you want. And also to answer questions of like, hey, I have this client who's struggling with this. I don't know where to start, or I don't know where to go. I don't know what the next thing is. And so we can workshop that together. So whether that is that you're asking that to me directly, or you have access to everybody else that's going to be in, right? So maybe you're a coach who's just getting started on this and you ask a question and I can answer it. Justin can answer it from his perspective, or, you know, this other physical therapist or chiropractor or, you know, these other coaches, they can give their 2 cents as well. And so that it's that we come together to help each other provide the best care possible. And my goal is to help as many people as possible, you know, professionals, provide what we talked about at the beginning of like, hey, you're never going to need me or anyone like me ever again for this thing, for, you know, for back pain, because now you're out of pain and you have all the tools that you need to deal with it if something happens in the future. Like you're equipped, you're ready to go. And so that's what I want for this mentorship. And, you know, it's still anybody that looks at my Instagram bio, like the mission is to get 1 million people out of back pain. And like, I can't do that on my own. Like there's no way. That's impossible. Not a chance. If I'm working with people one-on-one, if I have some more general programs for people who maybe may not need that individualized care, they just need a little bit of direction, some bumpers to keep them in their lane. And there are a bunch of professionals who are being trained, or they're gaining the knowledge that they need to be able to help other people do this. That gives you a shot. There's a shot at 1 million. So that's the plan.
That sounds amazing. Honestly, as someone who has called you up as a resource, just the idea of having regular access to your brain is awfully valuable. Never mind the curriculum and research and all of that. If I could, I think the coaches and clinicians is interesting breakdown and an important one. What kind of coaches, I know it's not a fully formed thing yet, unless it is, and you're about to launch it on the Feel Strong podcast, which is also acceptable. What would like an ideal coach to potentially be part of this mentorship be like? Like, what are they doing? What do they want to do?
Yeah, I think it falls in 2 categories. So there are the coaches who help people who are helping people with things that are more lifestyle oriented, right? So like a lot of your clients, right? Like they're not competitive athletes, right? So not competitive athletes, but they have things they want to do in life and they're not able to do them. A lot of times, right? This whole back pain thing rears its head in all walks of life. Maybe they need to lose weight, right? Maybe they have knee pain, whatever, right? They have these things along the way, but they have back pain too. And it's really difficult to work around that when you don't have a solution for it to help them to accomplish these other goals that maybe that's what they came to you for, but you have this big, stupid back pain thing in the way, right? So there's that. So that I would say that's going to be the main source or the main type of coach would be that one. But also those who are in like sports performance, right? So like I have a newer client recently that he's a college baseball player and he does fine with his normal everyday stuff, but he gets a little bit of pain when he swings a bat and he can't sprint, right? Like you can't sprint from home to first. Doesn't work, right? So I believe that's a really good example of a problem that maybe a sports coach or like a performance coach struggles to solve, and they need tools for that. Like, hey, this player can back squat, can lunge, can do all of these exercises, but he can't do that. And if he can't do that, he can't contribute. He can't really be an asset to the team. That puts things in jeopardy for the team and for the individual, right? So having the tools to be able to do that, the resources, people to bounce ideas off of, that matters. And then we have physical therapists.
Yeah, that's huge.
Chiropractors too.
Being able to keep the client in the gym, not just from the business perspective, not just you don't have to go somewhere else and pay someone else, but to provide people with the solutions where, no, we can keep moving forward toward what your goals are. And I have this incredible toolbox now to deal with back pain, as opposed to, that is something that so often throws the brakes on people's progress. Like, no, my back flared up again, coach. I should probably take the rest of the month off. I'll be in touch after the summer. Like, everyone has heard a version of that at some point, and being able to say with confidence, you should actually come in. Let's like run an assessment, see what's going on, determine, what we can potentially do. I'm not telling you have to work out 5 times a week, but sitting still definitely isn't the option. On the other side, what kind of clinicians do you think would find this valuable and interesting?
Yeah, I think a lot of it is the clinicians who are not satisfied or they're not okay with, first of all, the current kind of like model of care. But like a lot of it's for those clinicians that doesn't feel good for, right? Like I am obviously not in a traditional sense what you think of when you think of a physical therapist. And the reason for that is because it feels gross to me. Like it just feels gross of like, all right, we're going to do this stuff, but we're going to only do these things because that's what your insurance will pay for. And I have to work with 17 people. That's better. I got to have 4 people going at the same time where I'm calling out stuff to the tech, telling them to do stuff, which is going to be kind of a gray area of whether or not that's legal for me to, bill Medicare anyway. And
it certainly happens a lot.
And like, we're going to hope that things go well. But the big thing is like, I'm just going to be decreasing your activity so much and putting so many boundaries on it that I hope time takes care of it in the amount of visits that you have so that I can take credit for that later. Like, that's a pessimistic way of looking at it. I know. But I see it a lot. And
I suspect it resonates with some clinicians out there.
Yeah, it does. It does. I hate that so much. Like, I very seriously considered just leaving all physical therapy training stuff behind just because I was so put off by that. Like, I was like, this is horrible. Like, this is the dumbest thing ever. Of like, unless, like, the way that I felt was physical therapy was a complete waste of time for anybody who didn't just have surgery. Like, if you had an ACL reconstruction, great, do it. Shoulder surgery or something, like, if you had surgery, this is incredible. If you just had some sort of, like, I don't know, muscle strain or like tendinopathy, it's like, you just need to train a little differently or start training. You need some direction here to make you independent. So I'm rambling now, but clinicians who are dissatisfied with that and the level of fulfillment that they have, like, hey, here's some legit tools that make your work matter significantly more.
Pretty powerful. I mean, I have met, I think, I don't have a gigantic network of them, but overwhelmingly the physical therapists I know who are still like in the clinical model are pretty unhappy, and they're unhappy with the model. Like they often feel frustrated. They're not actually doing what they thought physical therapists did. They're not doing the thing that they thought they were doing when they signed up for this, frankly, pretty noble profession. There's not a lot of physical therapists, multimillionaires out there, but they're doing what you described, dealing with 4, 5, 6 people at a time, often in, less than ideal environments, and not allowed to use all of the tools that they might already know to solve problems because it's not covered under the current model. and that's not how you get paid. And we do need to keep the lights on. So this is just how it works now. And everyone seems to have kind of settled into the industry. I mean, has sort of settled into, well, this is just the way it has to be. So I guess this is the way we're going to do it.
Yeah. Hey, physical therapy departments in hospitals are lost leaders. I mean, that tells you everything that you need to know about the state of formalized rehab, right? It's not great.
Yeah.
So if you want something different, you got to bring something different to the table. And that's what I have to do.
I mean, I think you're already doing it. Lance, there's people out there who want to work with you, want to learn more, want to get some of these amazing resources you've already talked about. Send them where they should go. How should people reach out? How should people find you?
The easiest place is Instagram. That's where I make a lot of content. So you can find everything there. But it's dr.lance.tpt. That's my handle on Instagram. If you are a person who has back pain and you want to work with me, there's a client application in the link in the bio. With the mentorship that's coming up, I'll be posting about that on Instagram as well, letting people know things are coming. Yesterday, I posted a free sleep guide thing. So like I post things on there fairly regularly about that, of just giving little things away. But the mentorship, I'm shooting for that to be done, or at least not done, but the front portion of the curriculum will be done by the end of the month. So people can start rolling into that. Keep an eye out if that's something you're interested in.
And we are, to time date this, we're recording this in mid-August. So by the time you hear this, something's up and live. So go and look for it now.
There we go.
All that in the show notes, so people can, if you're listening on a device, you can just look down and press a button or two, and it should take you directly to Lance. Dr. Lance Einerson, thank you so much for coming on the podcast. This was a delight.
Yeah, it was awesome. Thanks for having me. Appreciate it, Justin.
Anytime.